Long answer questions. 1. What is a drug? Describe the various sources of drugs. A drug is any chemical substance used to diagnose, treat, prevent, or cure diseases and modify physiological functions. Sources of drugs. Natural sources. Plants, morphine from opium poppy, quinine from cinchona bark, animals, insulin from pancreas, thyroxine, microorganisms, penicillin from fungi, streptomycin, minerals, magnesium sulfate, iodine, synthetic sources, aspirin, paracetamol, semi-synthetic, heroin from morphine, biotechnological sources, recombinant insulin, monoclonal antibodies. 2. Explain the various routes of drug administration. Routes of administration? Oral tablets, capsules, syrups. Sublingual, under the tongue, e.g. nitroglycerin. Rectal, suppositories. Parenteral, intravenous IV, directly into bloodstream. Intramuscular, AM, into muscle. Subcutaneous, SC, under the skin. Topical, creams, ointments. Inhalation, asthma inhalers. Transdermal, patches. 3. Discuss the factors affecting drug absorption. Drug solubility and formulation. Route of administration. Blood flow to absorption site. Gastrointestinal pH and motility. Presence of food or other drugs. Surface area of absorption. 4. What are the different roles of nurses in drug administration? Assessment, patient history, allergies. Preparation, correct drug, dose, route. Administration, follow 10 rights of medication. Monitoring, observe for side effects. Documentation, record time, dose, response. Education, inform patient about drug use. 5. Advantages and disadvantages of oral route of drug administration. Advantages. Convenient and safe. Economical. No need for sterile technique. Disadvantages. Slow onset. First-pass metabolism. Unsuitable for vomiting unconscious patients. 6. Advantages and disadvantages of parenteral route of drug administration. Advantages. Rapid onset. Useful in emergencies. Avoids first-pass metabolism. Disadvantages. Painful. Requires sterile technique. Risk of infection. 7. Describe the factors affecting the drug action. Age and sex. Body weight. Genetic factors. Disease conditions. Drug interactions. Tolerance and resistance. Route and timing of administration. Short answer questions. And short notes. A pharmacokinetics, study of drug movement, absorption, distribution, metabolism, excretion. B. Pharmacodynamics, study of drug effects and mechanisms of action. C. First-pass metabolism, drug degradation in liver before reaching systemic circulation. And D. Therapeutic index, ratio of toxic dose to effective dose. Indicates drug safety. C. Competitive antagonism. Antagonist competes with agonist at receptor site. F. Synergism. Combined drug effect greater than sum of individual effects. G. Idiosyncrasy. Unusual drug reaction due to genetic factors. H. Loading dose. Initial high dose to quickly achieve therapeutic level. I. Prodrug. Inactive compound that becomes active after metabolism. J. Teratogenicity. Drug-induced fetal malformation. 2. What do you understand by the kinetics of elimination? It refers to how drugs are removed from the body. First-order kinetics, constant percentage eliminated per unit time. Zero-order kinetics, constant amount eliminated regardless of concentration. 3. What is a placebo? A placebo is an inactive substance given to a patient, often used in clinical trials to compare with active drugs. It helps assess psychological and physiological responses. 4. Enumerate the types of allergic reactions. Type Y, immediate. Anaphylaxis, asthma. Type 2, cytotoxic, hemolytic anemia. Type 3, immune complex, serum sickness. Type IV, delayed. Contact dermatitis, tuberculosis, skin test. Thanks for watching. Keep learning, stay curious, and let knowledge be your best medicine. Question 1. Alkalinization of urine is required for decreasing the poisoning due to A. Barbiturates, B. Amphetamine, C. Alcohol, D. Morphine. Answer A. Barbiturates. Which of the following is a prodrug? A. Enalapril, B. Clonidine, C. Salmeterol, D. Acetazolamide. Answer A. Enalapril. Which of the following drugs is commonly administered by intranasal route? A. Adrenaline, B. Desmopressin, C. Ganirelix, D. Insulin. Answer B. Desmopressin. Which of the following does not induce microsomal enzymes? A. Gimetidine, B. Grisofulvin, C. Rifampicin, E. Phenobarbital. Answer B. Griseofulvin. Loading dose depends on the following factors except A. Drug concentration to be achieved, B. Volume of distribution, C. Clearance of drug, D. Bioavailability of drug. Answer A. Drug concentration to be achieved. An old man enters the hospital with myocardial infarction and a severe ventricular arrhythmia. The antiarrhythmic drug chosen has a narrow therapeutic window. The minimum toxic plasma concentration is 1.5 times the minimum therapeutic plasma concentration. The half-life is 6 hours. It is essential to maintain the plasma concentration above the minimum therapeutic level to prevent a possibly lethal arrhythmia. Which of the following would be the most appropriate dosing regimen? A. Once a day, B. Twice a day, C. 4 times a day, D. Constant intravenous infusion. Answer D. Constant intravenous infusion. First-order kinetics is characterized by A. Dose-dependent elimination, B. Decreasing clearance as plasma concentration increases, C. Increasing the rate of elimination as plasma concentration increases, D. No relationship between the rate of elimination and plasma concentration. Answer C. Increasing the rate of elimination as plasma concentration increases. The neurotransmitters. Noradrenaline. Adrenaline and dopamine act through which of the following receptors? A. Single-pass transmembrane receptors, B. 4-pass transmembrane receptors, C. 7-pass transmembrane receptors, D. Ligand-gated receptors. Answer C. 7-pass transmembrane receptors. True statement regarding inverse agonist is A. Binds to the receptor and causes intended action, B. Binds to the receptor and causes opposite action, C. Binds to the receptor and causes no action, D. Binds to the receptor and causes submaximal action. Answer B. Binds to the receptor and causes opposite action. Drugs that should be avoided in G6PD deficiency are A. Chloroquine, B. Quinine, C. Sulfamethoxazole, D. Nitrofurantoin, E. Primaquine. Answer A. Primaquine. Drug efficacy refers to A. Effectiveness of drugs in life-threatening conditions, B. The maximal intensity of response that can be produced by the drug, C. The dose of the drug needed to produce half-maximal effect, D. The minimum dose of the drug needed to produce toxic effect. Answer B. The maximal intensity of response that can be produced by the drug. Therapeutic index is a measure of A. Safety, B. Potency, C. Efficacy, D. Selectivity. Answer A. Safety. True about orphan drug is A. Developed for orphans, B. Drugs used very rarely, C. Drugs used for rare diseases, D. Rare drug for common diseases. Answer C. Drugs used for rare diseases. Which of the following is true about placebo? A. Placebo is a dummy medication, B. Placebo is the inert material added to drugs for making tablets, C. Placebos do not produce any effect, D. All patients respond to placebo. Answer A. Placebo is a dummy medication. All of the following drugs can cross the placenta, except A. Phenytoin, B. Diazepam, C. Morphine, D. Heparin. Answer D. Heparin. Drugs that can be safely given in pregnancy are A. Antifolate, B. Quinine, C. Chloroquine, D. Primaquine, tetracycline. Answer C. Chloroquine. Increase in CAMP is caused by A. Somatostatin, B. V-beta receptor, C. A. Alpha receptor, D. Acetylcholine. Answer B. V-beta receptor. 18. As per the Drugs and Cosmetics Act, prescription drugs are included in A. Schedule C, B. Schedule H, C. Schedule P, D. Schedule X. Answer, Schedule H. It contains the list of prescription-only drugs in India. 19. Usually healthy human volunteers are taken in A. Phase 1 of clinical trial, B. Phase 2 of clinical trial, C. Phase 3 of clinical trial, D. Phase 4 of clinical trial. Answer, Phase 1. This phase checks safety and pharmacokinetics in healthy volunteers. Yeah. A drug that competes for an active binding site is called A. Competitive inhibitor, B. Non-competitive inhibitor, C. Covalent inhibitor. Any of these. Answer, competitive inhibitor. It competes with the substrate for the same binding site. 21. Bioavailability of a drug is nearly 100% when given by route. A. Oral. IFO. C. Transdermal. D. Inhalation. Answer, IV route. Intravenous administration bypasses absorption barriers and gives 100% bioavailability. 2. Tick the prodrug. A. Enalapril. B. Dopamine. C. Nitroglycerin. E. Aspirin. Answer, enalapril. It is converted in the body to the active form, enalaprilat. 23. Major route of drug elimination is A. Biliary, B. Alveolar, C. Renal, D. Dermal. Answer, renal. The kidney is the main organ for excretion of most drugs. 24. Solid drug preparation meant for rectal administration is A. Suppository, B. Emulsion, C. Pessary, D. Tablet. Answer, suppository, a solid form used for rectal, vaginal, or urethral administration. 5. Maintenance dose is calculated by using value of A. Clearance, B. Volume of distribution, C. Oral bioavailability, D. Daily dosage. Answer, clearance maintenance. Dose depends on clearance to maintain steady-state concentration. 26. Which among the following is true about rectal route? A. Used for irritant and unpleasant drugs. B. Cannot be used in unconscious patient. C. There is predictable absorption of drug, thus diazepam cannot be given via rectal route of administration. Answer, used for irritant and unpleasant drugs. Rectal route helps avoid gastric irritation.